Good evening, everyone. My name is Dr. Jennifer Chin, and I'm honored to be this event's Mission Moment speaker. I am sorry I cannot join you all in person, as unfortunately, baby boy Atlas and I both have COVID. We are both feeling much better, but need to recover at home and did not want to expose all of you to our infection. I would like to tell you about what Project Access has meant for me and how it has shaped the doctor I am today. As I was finishing my undergraduate degree in public health at University of California, Berkeley, I knew that I wanted to work more closely with patients before starting medical school. Ironically, a Google search on the World Wide Web led me home through Campanus. After several phone calls and meetings, Craig Darling and Gary Davis put me in touch with Sally Neely at what was then called King County Project Access, or KCPA. It was immediately clear that this organization truly cared about the greater Seattle community and wanted everyone to have access to appropriate, timely specialty healthcare services. I deferred my acceptance to Tulane University Medical School, moved back home, and started off as an intake coordinator at King County Project Access, now Project Access Northwest. Through this role and my eventual role as a case manager, I developed a much deeper understanding of what patients go through to access necessary healthcare. I had learned about economic instability, food insecurity, and health literacy in my public health classes, but nothing made these concepts more real than talking to patients every single day. Through this year-long experience, I also met the love of my life, Alex Heisenrader, who was placed through Campanus at the Faith Action Network, and it is thanks to this year-long experience that baby boy Atlas is here today. When I started medical school in New Orleans, Louisiana, I saw even more health inequities driven by poverty, racism, and historical trauma. While rich white patients were able to pay out of pocket to see private physicians, poor Black patients had limited options and often were only able to see providers in training clinics that were understaffed, inefficient, and biased. Many patients were not able to receive adequate comprehensive care due to their race or socioeconomic status. At Project Access Northwest, I had learned to respect each patient and to try to understand their circumstances before passing judgment or making assumptions about the care they needed. I saw how these inequities particularly affected people who were capable of pregnancy, and I decided to dedicate my life to the field of obstetrics and gynecology. I completed my OBGYN residency at the University of Hawaii and recently graduated from the Complex Family Planning Fellowship here at the University of Washington, where I have joined as assistant professor. Every day, I am honored to listen to patient stories, provide evidence-based, compassionate care, and help people realize their hopes and dreams. I strive to treat every single patient with dignity and respect, using skills and knowledge I gained through my work at Project Access Northwest. I am able to converse courteously and effectively over the phone due to my many hours as a case manager at Project Access Northwest. I never turn away patients when they're late, as I know how many obstacles might exist by talking with patients at Project Access Northwest. I'm so grateful for the time I had at Project Access Northwest and the work that everyone continues to do. I have gained a brand new perspective on the importance of access to healthcare after recently going through my own pregnancy and taking care of my 6-month-old baby boy. I suddenly developed high blood pressure toward the end of my pregnancy and needed to be induced to prevent complications for both myself and baby Atlas. I remember being shocked by my diagnosis, but grateful that I had reliable access to excellent healthcare in order to have a safe labor and delivery experience. It is my hope and belief that we can achieve equitable access to high quality, compassionate healthcare for all people in our society. Especially now, it is essential and vitally important to continue to strike down barriers to healthcare for patients, no matter the color of their skin, their zip code, their income, or any other barriers that may make caring for themselves nearly impossible. Thank you to everyone at Project Access Northwest for striking down barriers every day. And thank you to all of you who kindly support the work that all of us are responsible for, caring for and uplifting each other in our times of need. Please donate generously and enjoy the rest of the evening. I hope to see all of you in person soon. Thank you.